So what if I told you that one of the most common anti-nausea drugs that we use in dogs might also reduce surgical pain and even make spays easier? A brand new veterinary journal study suggests exactly that. Most veterinarians know that meropitin, also known as Cerenia, is an anti-vomiting, anti-nausea medication. It blocks neurokinin 1 or NK1 receptors, preventing substance P from binding. And substance P isn't just involved in nausea. It's also one of the body's major neurotransmitters for pain transmission, especially visceral pain, the pain that comes from internal organs. So researchers asked a really interesting question. Can blocking substance P reduce pain during abdominal surgery? And this study was a prospective randomized blinded clinical trial. Researchers enrolled 72 healthy female dogs undergoing routine ovariohysterectomy. The dogs received dexmedetomidine as their pre-medication, plus either in group 1, methadone, which is an opioid, or in group 2, just meropitin instead of methadone. And they looked at several things. They looked at heart rate and blood pressure and respiratory rate, the need for any additional fentanyl, which is another opioid, the amount of sevoflurane or gas anesthetic needed, postoperative pain scores, and something I'd never seen studied before. They looked at how easy it was to exteriorize the ovaries during surgery, meaning pulling on the ovaries so that we can see the blood vessels to ligate them before we remove the ovary. But here's where things got really interesting. Dogs that were receiving meropitin required less sevoflurane during ovarian ligament traction, which is usually a very stimulating part of the surgery. And this suggests that meropitin's reducing the amount of inhalant anesthesia needed during one of the most painful parts of the procedure. They also looked at pain scores. So postoperative pain scores were lower during the first few hours after surgery, and fewer dogs required rescue analgesia according to the abstract. But here's a nuance when you actually read the paper. The paper reports that pain scores were generally low in both groups and differences became less apparent over the first 4 hours. That's an important reminder not to overstate the findings in an abstract. The most fascinating finding, I think, is that the surgeons also noticed something that was unexpected. The ovaries appeared easier to exteriorize in dogs receiving meropitin. Now, this is subjective, but veterinarians do a ton of spays, and so I do value this opinion in the paper. And the authors speculated that this was because blocking NK1 receptors may reduce visceral smooth muscle tone or even alter those viscerosomatic reflexes. So in simple terms, imagine pulling on a rope that's under a lot of tension. Now imagine someone loosens the tension a little bit. The rope doesn't change, it just becomes easier to pull. And that may be what's happening with the ovarian ligament. Importantly, this trend did not reach statistical significance, so it's an intriguing observation rather than a proven effect. But wait, I read in the paper that the heart rates were higher in the meropitin group compared to the methadone group. Yes, that's true. So dogs that were receiving meropitin had higher heart rates and respiratory rates throughout the entire anesthesia. And at first glance, I know that I thought they must be hurting more or experiencing some of that tugging or manipulating more. But the authors believe the more likely explanation is that these dogs were less deeply sedated because methadone itself does slow heart rate and produces greater sedation. So the higher heart rate didn't necessarily mean worse analgesia. Now, does this mean that we should stop using opioids for every spay? Nope, not yet. This is a relatively small single-center study, but it does add to the growing evidence that meropitin may provide more than just antiemetic effects. It may reduce visceral pain, it may decrease inhalant anesthetic requirements, it may serve as part of an opioid-sparing anesthesia protocol, and possibly improve surgical tissue handling. And these are all really exciting possibilities, but they still need confirmation in much larger studies. So some of our oldest drugs still have new tricks to teach us, and meropitin may be much more than an anti-vomiting medication. It may become an increasingly valuable part of multimodal anesthesia. I know that every anesthetic patient that I'm placing under anesthesia for surgery is getting meropitin as part of their pre-medication, both for their antiemetic effect of the drug as well as for analgesics. What are you doing in your clinic? Are you considering using meropitin as part of an opioid-sparing anesthetic protocol? Are you using it in all of your cases as a pre-medication? Let me know in the comments below.